Yeah. Hello, everyone. I welcome you today to this session on pre-pregnancy counseling by Apollo Cradle. To speak on this topic today, I would like to welcome our doctor, Dr. Rashri Shankar. She's an in-house consultant. She's an obstetrician and gynecologist associated with Karapakam Center of Apollo Cradle Hospital. She has done her gynecology and MRCOG, and she is well known in this field, and we are looking forward to hear from her on the main topic, that pre-pregnancy counseling, how to prepare ourselves for a healthy low risk pregnancy, which is always there on everyone's mind, of how to go about being more safe and healthy during these times. So we all are looking forward to hear from you, madam. It's all yours. Thank you so much.
Thank you. Good afternoon, everyone. I'm Dr. Rajshri, a practicing consultant gynecologist and obstetrician based out of Apollo Cradle, Karapakam. It's lovely to be here meeting you all this afternoon. I hope you're all having a lovely Monday. I know a lot of people are in the stages of planning pregnancy at the moment, especially after this COVID situation is actually getting a lot better. I know a lot of you have actually postponed having pregnancies for the last couple of years, waiting for the situation to get better. And so I thought there is no better time than this to actually start talking about how we can go about planning for a pregnancy that is relatively risk free. A lot of times I meet couples in my clinic where they come to me when they are actually pregnant, and then during the first visit we start to identify problems. And this got me thinking that no, instead of having to identify problems in the first stage of pregnancy, we should actually try to pick these problems up before somebody gets pregnant. So that gives us a bit of time to actually get these problems under control. And the whole point of basically doing this is, if you get these medical problems under control before pregnancy, then the chance of these problems actually causing problems in the pregnancy, in the developing baby, can actually be minimized to a great extent. So that brings me to this important topic of how you go about preparing. And one of the basic things that you can actually do is, when you want to plan a pregnancy, it would be a good idea to actually go and see your obstetrician. And the whole aim of this visit, like I said before, is to actually look at your past history, see what problems you might have. For most women, actually, there are no major issues. Most women would fall in the low risk category, where the basic advice would be sufficient. But there will be a small group of women where problems are there, which we have not actually identified so far. And this visit is a very important visit to identify these issues. Either way, whether you consider yourself with medical issues or no medical issues, whether you think you're fit, young, healthy, I think everybody has to have one visit with your obstetrician when you're actually planning a pregnancy, because most times it's all um, not only about giving you advice on how to plan the pregnancy, but it's also about identifying problems that you might not think you have, but that we are picking up in these clinics quite often. And that brings me to the most common thing that women I see in my clinic come to me with, which is polycystic ovaries. And polycystic ovaries is a big issue, and it's rampant everywhere. Most young adults have it, and I think that's because of a combination of the diet and lifestyle that we actually follow nowadays. And the specific thing about polycystic ovaries and pregnancy is that there are certain specific issues that can be a problem for women with polycystic ovaries, starting with irregular periods, which itself is a reason for why getting pregnant might be a problem for these people. Combine it with being overweight and also having diabetes or pre-diabetes in these women. This group of women needs special counseling sessions to actually prepare them for pregnancy. So number one that we do for women with polycystic ovaries when they visit us in clinic is to get a proper history from them, identify whether they have regular cycles, check on their weight, check on their blood pressure, do a basic profile, which basically involves checking on their sugars, checking on thyroid, And for all women, this is a common test that we would do for all women, which is testing for thyroid, testing for sugars, and testing for something called rubella. Rubella, the protection against rubella. Rubella is a bacterial infection, and most women would have been vaccinated in childhood against this. The important thing about rubella is if rubella develops in pregnancy, it's an infection, but if it happens in pregnancy, early pregnancy especially, it has 100% chance of causing defects in the baby. So it's important so it's important basically to identify that these all women who are planning pregnancy are protected against rubella, and it basically means just taking a vaccination. So this protection happens. So these are the basic tests that we would do for everyone who would want to plan a pregnancy. What I mentioned again: thyroid, your sugars, and rubella immunization. Now, also when you come to the clinic to meet your obstetrician, she or he will actually go through what has happened in the past. Have you had any difficulties getting pregnant? How do you have any medical problems that you actually know about? um, are there other medical issues that we need to think about with your history of medical issues in the family? These are all things that we would actually look at in your history. Have you had pregnancies in the past that were complicated? Do you have a history of repeated miscarriages? So these are all the points that we will be looking at when you actually come to the clinic, when we take details from you. And all these details basically we actually take from you to identify whether you are at risk of developing certain specific problems in pregnancy. Now, going back to what I was talking about earlier, women with polycystic ovaries, the main risk in women who have polycystic ovaries who also tend to be overweight is a very high risk of diabetes developing in pregnancy. Most of these women are actually pre-diabetic when they come to see us, and actually seeing them in clinic and doing tests for sugar helps to identify these women who are at risk of getting diabetes in pregnancy. So identifying that and trying to get a good control over that is actually a very good way of actually preventing, or to a great extent delaying, the onset of getting diabetes in pregnancy. Another issue that we would also test for when you actually come to the clinic would be to identify whether you have blood pressure issues. Again, this is mostly not picked up because most women are young, so they don't go for regular checkups. So the first time we identify blood pressure issues is also when we actually see them in the pre-pregnancy clinic. So these are the common things that we look for when we see women. So now coming on to the group of women who are at low risk, who have none of these medical issues, have no actual history of polycystic ovaries, the commonest problem that I see in these young women is being overweight. Again, being overweight is not good from the pregnancy point of view. One, it can lead to irregular cycles. Number two, it is also a risk factor for developing diabetes in pregnancy. So a good way to actually start planning for pregnancy is to actually check your weight and height and check to see that you're in the normal BMI range. So there are a lot of calculators that are available now to see what your BMI should be. And if you enter these details, enter your height and weight onto these measuring systems, it will actually tell you what your BMI is. And your normal BMI should be somewhere between 20 to 24, 25 would be a normal BMI to be at. And the importance of knowing that you're in the right BMI again comes down to, if you're in a higher BMI, you're at higher risk of becoming diabetic in pregnancy. You're also at higher risk of having high blood pressure issues. So this is when you come to a pre-pregnancy clinic, it is not just about making you healthy for the pregnancy. This is also a time for you to start becoming healthy generally, because getting healthy doesn't stop with just pregnancy alone. You're looking at post-pregnancy maintaining good health for the rest of your life. So none of this is short term. What I'm talking about now, or going to talk about in the rest of the talk, also is about following a healthy lifestyle, that you just do not stop when you get pregnant or even during pregnancy. This is something that you will have to make part of your life so that you follow it long term. So which brings to the brings me to the main point of my talk today, which basically is how do you get yourself fit for pregnancy. And like I said earlier, the first step is to identify where your BMI is. Check your blood pressure, check your sugars, do all those tests. And once you know that you're overweight, which is the commonest problem that I see in young women in my clinic today, is this problem of being overweight. And for all these women who are planning pregnancy, the first thing I get them to do is to go on a good diet plan. I mean, dieting doesn't necessarily mean giving up everything. Dieting actually means selecting foods that are good for you and to eat it at regular intervals. Okay, so what foods to eat? The general rule of thumb is cut down on your carbohydrate intake, which is your white rice, your dosa, idli, chapatis. The quantity of that, bring it down on your plate. Add a lot of green vegetables to your diet. Eating a lot of green leafy vegetables is actually very good for you. And most women tell me if they eat less, they tend to feel hungry. They're not able to do their daily activity. So to them, I tell, make sure that your plate has very little carbs. What I talked about earlier, and a lot of protein on the plate. If you're non-vegetarian, that includes eating lean meat, eat steamed chicken or fish. Try to avoid deep frying any of your non-vegetarian food. So keep it as fresh and steamed as possible. So eat a lot of protein, and if you're vegetarian, that means including a lot of dal on your plate, and that also includes your chana, your boiled chana, your sprouted dals. And all those give you a lot of protein, which actually one is good for you. The number two, it makes you less hungry through the day because protein does get broken down slowly into your blood, which means it keeps you feeling not hungry for a long period of time compared to eating white rice where you might feel full initially but you need to eat a lot, but again you start to feel hungry within a short time. So eating a lot of protein actually helps you in both ways actually. And eating a lot of green leafy vegetables, again, one, it's good for you, has a lot of fiber, has a lot of vitamins and iron too, which obviously which a lot of young women are deficient in. And of course, it also keeps you full for a long period of time. And eating this most of the time, eating these meals, home cooked meals, most of the time, is usually before sufficient to keep your weight under check. And the second most important thing in addition to diet is actually exercise. Now, a lot of people worry about exercising when they are planning pregnancy. But what all research has shown is that exercise is good for you even while planning pregnancy, whether it's in the first half of the cycle or the second half of the cycle. It's actually a good thing, keeps you healthy, keeps your weight under control, keeps your cycles regular. So you do not have to worry about stopping exercise when you think you're in the second half of the cycle. Exercise is perfectly safe to do while planning pregnancy, during pregnancy, and after pregnancy. Now, what you do, the simplest thing form of exercise that I advise all young women is to just start walking. Brisk exercise, 45 minutes, 5 days a week is usually sufficient exercise. If you're able to do more, of course, you can. But the simplest thing to do would be this. And you cannot suddenly start and do this overnight. Start off with doing walking for about 15-20 minutes a day and slowly build it up to 45 minutes a day. So this is something that if you constantly follow with good diet, this is usually sufficient to keep your weight under check. Also to reverse problems with pre-diabetes. Now, following the diet that I mentioned before with regular exercise is a good form of making sure that your sugars do not shoot up and that you do not become diabetic before you become pregnant, or even in pregnancy. If you continue to follow this, there is a good chance that you even people with pre-diabetes can keep their sugars under good control just by diet and exercise alone. So this is something that I advise all my young women to start following soon as they come to see me when they are actually planning pregnancy. And I find that if they are able to follow this on a regular basis for a few months, then when they actually become pregnant, it becomes easier to continue to follow it. Most young women in the first part of pregnancy have a lot of vomiting, tiredness, not being able to get out of bed. So they find it really difficult to start following all these healthy um, uh, lifestyle changes when they become pregnant, because definitely getting being able to do all this when you're already feeling tired and in bed is difficult. And then what happens is, when you pick up pre-diabetes in these women, they tend to go on to medication straight away. So if you're able to follow all these beforehand, then just continuing to follow this in pregnancy means that we can delay starting medicines for diabetes for most of these women, and most of these women can continue maintaining their sugars just by doing this alone. So that's the most important part of my talk today, that I would want all you women who are planning pregnancy, and it doesn't necessarily mean just planning pregnancy, to go on a regular diet and exercise program, so you continue to be healthy before pregnancy, during pregnancy, and post pregnancy too. All research has shown that if you start exercising, build up a good muscle mass by the time you're 20 years old, then your bone mass actually increases, which means if your bones get very strong, most of this you should be doing it in your teenage years before you hit 20, because your main muscle mass and bone strength happens before that. After that, there is a plateauing, and after you become will get into the premenopause and postmenopause years, most women will start to lose bone mass. So most of your strength is built up in these years. So it comes again down to good diet and exercise that you should be starting to follow quite young in life. It's we do Most of us think that we need to start exercising only when we are in our 20s, 30s, 40s. That's not true. Most of our exercise and healthy habits should start when we are actually quite young, because like I said, once we cross 18, 20, our maximum bone mass is already done. So if you start off with a negative deficit there, it's only going to get worse. And especially post-menopause years, we pick up a lot of osteoporosis, which is thin bones, risk of fracture is high. So start exercising when you're young. Continue to exercise to maintain that muscle mass and bone mass. And that actually will take you on for a healthy, long, healthy life. So I know we are talking about pregnancy and having a low risk pregnancy, but the whatever I'm mentioning now, to keep yourself healthy, doesn't stop with just becoming pregnant alone. This is something that you need to look at long term for the rest of your life. So let me come down to take some questions now. Now that we've had a brief talk, and we'll come back and I can explain more about what else you can do. So the first question is, how long before planning a pregnancy should we start on folic acid? Ideally, a couple of months before you plan pregnancy would be a good time to start folic acid. Now, folic acid is a B vitamin. The aim of taking folic acid before pregnancy and in the first 3 months of pregnancy is to reduce the risk of spine development problems in the fetus. So the development of the spine in the fetus happens in the first few weeks, and it's usually completed between 10 to 12 weeks. So during this time, it's important to take folic acid to reduce the risk of spine developmental issues. So how much of folic acid you take? Normally it's about 400 microgram of folic acid is the general recommendation that you have to take, and it doesn't matter when you take it. Just remember to take one tablet a day, any time of the day, and continue taking it, like I said, pre-pregnancy and also for the first 3 months of pregnancy. Now, I mean, some people think that it's enough to eat green leafy vegetables, but we do not really know the quantity of folic acid that is there in diet, which then makes it important for us to take folic acid in tablet form. So it's important to start that. Anybody planning pregnancy, start folic acid starting 1 or 2 months before you actually plan pregnancy. Continue taking it till you're pregnant, and then for the first 3 months of pregnancy. Now, the next question is from Ms. Aarti, who's asking, should we check our medicine with Gynec before planning pregnancy? Yes, definitely. I'm saying whether you have medical issues or do not have medical issues, it's always good to see your obstetrician before you plan pregnancy. And like I said before, sometimes problems are already there. Sometimes there are problems that you might not know are there, but identifying these problems and actually getting them under control is the whole point of starting to plan for a healthy pregnancy. So definitely, yes, do meet your obstetrician. And the next question is, if you're unable to manage stress, do you suggest we should postpone planning pregnancy? To this, my answer is, when does stress start? When does stress stop? I mean, life is full of stress, and sometimes it's about how we actually manage stress, and it doesn't stop with just pregnancy. I mean, there is no direct correlation between stress and, for example, miscarriages. It's difficult to quantify stress also. So I don't think there are any studies that have said stress can directly cause these issues. Of course, pregnancy comes with its own set of problems, physical, emotional, and having a steady state of mind, happy state of mind is something that you would want, whether you're planning pregnancy, whether you're in any stage of your life. And managing stress again, stress is not, like I said, you cannot quantify it, but a good way of managing stress basically is exercise, and yoga is a good form of exercise which deals with both your physical and mental state of mind. So for most people, I do advise that, no, doing yoga at least twice a week would be a good way of actually keeping your muscles active, and also help with managing stress mentally also. So definitely yes. I mean, but I don't think there is any reason to postpone pregnancy. If you want to plan pregnancy, stress is something that you have to constantly work on in your day-to-day life. And like I said before, doing yoga, finding other outlets for how to reduce stress, look at all those things. But that should not be only a reason to postpone pregnancy, because when does stress stop? So I guess you have to figure out a way of dealing with stress. But simultaneously, if you are young and you can postpone pregnancy and you think life will be better in a few months, if you want to do that, that will be fine. But you, just because there is stress, I don't think there's any reason to postpone pregnancy. Okay. And the next question is, where is this pre-pregnancy counseling done? Okay, pre-pregnancy counseling is just going and actually seeing your obstetrician or your gynecologist, having a chat with him or her about, your specific problems, identifying problems that are not there, which means either just doing a check, getting some details from you, identifying what problems you might have, testing for those problems. And actually, if any problems are picked up, which I already mentioned before, like blood sugar issues, then getting those under control. And this is done in any outpatient clinic. So you go to your local obstetrician or gynecologist, and all this will automatically get done when you go and have a chat with her that you're actually planning pregnancy. So so nice to get all these questions. Excellent. So what we will do, now that we have gone through these things, if there are no more questions, I wish you all a very safe pregnancy. Do try to inculcate all these healthy habits into your day-to-day life. And like I mentioned before, all these tips that I have given do not stop with just getting pregnant. Try to inculcate this in your day-to-day life that you can follow for the rest of your life too. It was nice chatting with you all this afternoon. Good day.
Thank you, ma'am. Thank you so much. I will end the broadcast. It was wonderful listening to you. Ma'am, there is just one question where someone is asking
Yes.
that what are the suggestions that we should take in this corona times? Anything that we can avoid the risk?
Okay. Okay, that brings me to this important point. Do get yourselves vaccinated. That's the number one message I want to give. I still see women in my practice. I mean, I think we started vaccinations more than a year ago, and I still see young women walk into my clinic who say they haven't had vaccination because they've had eczema, or skin rash. And no, there are so many patients who have still not, so many women who still haven't had their vaccinations done. So please go ahead and get yourselves vaccinated. There are very, very few reasons not to get vaccinated. Almost everybody is actually suitable for vaccination. So in these COVID times, with good vaccination available, please get yourselves vaccinated. And all the recommendations that are necessary for not getting COVID, even whether you're trying to get pregnant or not, follow the same guidelines, and that means using your mask and following social distancing. So, but the most important message I want to give is please go and get yourselves vaccinated. The good thing about COVID is so far we have not seen any serious issues even developing COVID in early pregnancy, like some viruses which cause malformations or abnormalities in the fetus. We're not seeing that along with COVID. So the advice now is not to postpone pregnancy in these times. So you can definitely go ahead and plan pregnancies, but do go and get yourselves vaccinated if you have not had it done yet.
Thank you, ma'am.
So
Thank you
thank
so
you.
much for, yeah,
Thank
thank
you.
you for the wonderful session. It was really quite informative. Thank you so
Thank you
much.
very much. Thanks for having me here. Yeah.
Thank
See you all. Bye.